When was the last time you tried to access sexual and reproductive healthcare? Where was it you went? Did you struggle to get an appointment which fitted in with your working hours, or just struggle to get an appointment at all? Would it be easier if you could go somewhere that had longer opening hours or you didn't require an appointment? These questions are at the core of my PhD. I'm a sexual health nurse with over 25 years' experience with a passion for increasing access to services, especially for those who are most vulnerable to poor sexual health outcomes. My PhD explores the role that community pharmacies can play in delivering sexual and reproductive healthcare in Scotland. The unique selling point of my PhD project is that I'm exploring sexual and reproductive healthcare from a systems perspective, focusing on how community pharmacies fit into the system of sexual and reproductive healthcare delivery within Scotland. I will use a soft systems approach to accomplish this. My project is aligned with Scotland's Women's Health Plan, so is focused on women, particularly those with the most need. The first step is to complete a review of literature which will focus on women's experiences of accessing sexual and reproductive healthcare in high-income countries and how community pharmacies can help address inequalities. A series of workshops will be used to gain the opinions and perspectives of key stakeholders, both professional and lived experience groups. The lived experience groups will cover 3 specific areas which research suggests struggle to access services: 19 to 25-year-olds, people affected by rurality, and a group focusing on menopause care. Additionally, I'll have a workshop for transgender men, as the barriers they face trying to access services can be different to other lived experience groups. A professional advisory group and women's advisory group will run concurrently throughout to help inform and guide the research process. Through these workshops, I will first map the current system of sexual and reproductive healthcare in Scotland. A second workshop will focus on the ideal system, with a final workshop bringing these 2 system maps together to create a feasible systems map of sexual and reproductive healthcare in Scotland, highlighting leverage points, areas of improvements, and barriers. Recommendations will be co-created through the workshops, which will add to the growing body of evidence in this area, input into future policy development, and in turn, increase access to services for those most in need, working towards a vision of a more equitable and accessible sexual and reproductive healthcare system in Scotland. Thank you.